Good evening, everyone. I'd like to welcome you all to this very special webinar. The National Council on Skin Cancer Prevention is proud to present insights from dermatologists with a national perspective. This webinar is specifically for members of the Dermatology Interest Group Association. My name is Becky Kamowitz. I'm the Senior Director of Marketing Communications at the Skin Cancer Foundation, and I'm also the co-chair of the National Council on Skin Cancer Prevention. This webinar is the beginning of what we hope to be an ongoing relationship between the National Council and DIGA, a relationship that will continue with new and current members and those who go on to practice medicine. Our goal is twofold: to help DIGA get introduced to and involved in the skin cancer education community, and to help the National Council connect with the next generation of dermatologists. Dermatologists are on the front line of the skin cancer epidemic, and their expertise and perspective is so important to the work of all of the members of the National Council. Now, we also see a lot of synergy between the Council and a collegiate group like DIGA, as we have a campus-centered initiative, the Indoor Tan-Free SkinSmart Campus Initiative, which you'll hear more about shortly. We do have a few housekeeping items to review. Just in case this is anyone's first ever video conference, we will ask that you stay muted unless you are speaking. And as you all got that notification, you know we are recording this webinar for those who are unable to join us tonight and for your future reviewing, if you'd like to take another look at it. We'll post this recording on the National Council's website and include the link in a follow-up email. If you have any questions for our panelists or any of our other speakers tonight, please post them in the chat box, which we will be monitoring. And our hope is to allow time for questions after the initial discussion. If we get a lot of questions and run out of time, we will do our best to work with the speakers to answer those questions and include them in the follow-up email. Moving on to our agenda. Just a quick run through so you know what to expect tonight. I'll talk a little bit about the Council's work. One of my fellow Council members will talk more about SkinSmart Campus. We'll have our panel discussion, and then we'll talk about how DIGA and the Council can work together. Now, just a heads up that at the very end, a poll will pop up, a little survey that we ask you to take a moment or two to fill out, give us some feedback about the event. It's really valuable to us. It will help inform future webinars that we hope to have, so please do take a moment when that pops up at the very end. And now we will, on the next slide, learn about the National Council. I'm just going to provide a little bit of an overview. Yep, we can move on to the next one. There we go. The Council was formed in 1998 to bring together various organizations, associations, and agencies that share a common goal of educating the public about skin cancer prevention. The Council is an organization with the vision of a united voice to create a world without skin cancer and a mission to prevent skin cancer through education, advocacy, and raising awareness. The Council currently has more than 40 members, representing the nation's premier physicians, researchers, clinicians, and advocates for melanoma and non-melanoma skin cancers. Moving on to our next slide, here is a sample of our members. Core members of the National Council include the American Academy of Dermatology, the Melanoma Research Foundation, Melanoma Research Alliance, Impact Melanoma, and the Skin Cancer Foundation. You'll also see here we have many more general members representing organizations around the country, and we also liaise with several federal agencies. Moving on, we'll take a moment to talk about a few of our initiatives and priorities, beginning with Don't Friday, one of my favorites. So the Council declares the Friday before Memorial Day as Don't Fry Day, as in don't fry your skin on this first day, unofficial day of summer. And it's all about raising awareness about sun safety. It's primarily a social media campaign. It's actually been going on for 14 years. And in the last few years, it's gained a lot of momentum, particularly online. We get a lot of help from media, from social media influencers, and a lot of other organizations help us spread the word. So we hope you'll all consider becoming involved in Don't Friday. Help us spread the word on your social media channels to your friends and family. You can find much more information about Don't Friday on our website. Moving on to SkinSmart Campus, this is our other major initiative where we recognize universities that prohibit indoor tanning devices on campus and promote skin cancer prevention among students and faculty. And as I said, one of my fellow council members will talk more about that shortly. Our next slide. So we have two legislative priorities. One is passing legislation to prohibit minors from using tanning beds. It's kind of hard to believe that in many states, it is still perfectly fine for a 13 or 14-year-old to go into a tanning salon. Currently 22 states plus Washington, D.C. have passed legislation banning minors, and we are really working hard to make that national legislation and make that ban on the national level. So we continue to lobby Congress and work with the FDA to hopefully make that happen in the next few years. Our next slide, ensuring children have access to sunscreen. So this is our other legislative priority. Believe it or not, some schools do not allow students to bring sunscreen to school and apply it as necessary, or they instruct students to bring it to the nurse's office. So we really want to help make sure that children are empowered to protect themselves throughout their school day and at summer camp. They're educated, they're empowered, and they have access to what they need to protect their skin from further damage. That's a barrier we're working to knock down. And I will pass it over now to Deb Gerard, the Executive Director of Impact Melanoma and the co-chair of the SkinSmart Campus Initiative.
Thank you, Becky. I'm so happy to be here to share this really important initiative through the National Council. As Becky told you, this is an initiative to block indoor tanning on college campuses, but even more, it really is to begin the process of building policy statements at colleges around the country, not only around indoor tanning, but also around bringing education around sun awareness. Could I have the next slide, please? One more, Teresa, thank you. We began this program after an initiative in 2014 from the Surgeon General's office. And we had a very important moment in time where we began looking at a call to action to prevent skin cancer. This is a program that from a public health perspective has been modeled after tobacco-free campus initiatives. And clearly, we need the grassroots of students on campus to begin these programs. And then our staff really does a great amount of work in helping with the operational details to making this happen. But developing policy on our campuses is a really important place. And what we found is that work that begins on the campus can really spill out to communities. And this is a wonderful way to promote sun protection education in college communities and their surrounding cities and towns. Next. One of the things that is really important in a requirement to be a SkinSmart campus at the upper levels is that no campus or off-campus housing has any indoor tanning as an amenity. They do not allow students to use debit cards to pay for indoor tanning sessions. And there must be an educational web page that really focuses on these issues. And folks from the SkinSmart campus staff are really helpful in collaborating with the schools to make this happen. And we work with the schools in providing an indoor tan-free college campus memo of understanding with the National Council. So there's a fair amount of work to get started, but you'll have lots of people have lots of support to get it done. Next slide. So if you are a platinum level school, meaning you've just done all the things that I talked about, you receive a framed SkinSmart campus certificate, 2 free sunscreen dispensers, and free sunscreen for a year. And we feel like these are really important, tangible items to have on campus to really bring home the importance of safe skin everywhere. You'll receive national recognition, campus signage, and ongoing support as we build these programs out. This is just a listing of some schools, some of our platinum schools. You'll see that they are schools from all over the country. They've completed their platinum requirements, and we have another list of schools that we are working with to bring them into this level as well. One would have thought that the pandemic would slow things to a halt, but in fact, we've still had many schools that whose students are outdoors, who still have these issues that they are trying to deal with from a policy perspective, and have been very active during this period of time. Next slide. Becky, I'm going to turn it back to you.
Thank you, Deb. All right, so we will move into our panel discussion now with three renowned national dermatologists. Joining us tonight, Dr. Boris Lishniak, the Dean of the School of Public Health at the University of Maryland, the former acting U.S. Surgeon General, and my co-chair on the National Council. Dr. Henry Lim, Senior Vice President of Academic Affairs at Henry Ford Health System and the former chair of the Department of Dermatology at Henry Ford, as well as the former president of the American Academy of Dermatology. And Dr. Ade Adamson, Associate Professor, Dell Medical School, the University of Texas, Austin. Doctors, thank you so much for joining us tonight. We are so happy to be here with you. We have several questions for you, so we'll just get right into it. We don't have a lot of time. Our very first question to kick things off, what do you wish you knew when you were starting your career in dermatology? And I'll ask that as you answer this question, perhaps you can tell us a little bit about how you chose that career path in dermatology. We did not talk about who would go first. Would anybody like to volunteer to kick us off?
Boris, you can start.
Well, thank you. Thank you so much, Henry, for allowing me to start. And to Becky and to Deb and to the Derm Interest Group Association for having us all here today. You know, it's sort of an interesting question to sort of what do I, you know, kind of wish I knew when I started my derm career. And I'll start with that. My pathway was a little bit different. And so therefore, what I wish I knew, and to all our medical students out there who are interested in dermatology at this point in their lives, it's guess what, folks? There's no one single path to do all this, right? I wish I knew at the time saying that, oh, there's only one correct way to become a dermatologist, right? And you know, I'm going to do what Dr. Adamson did, or I'm going to do what Dr. Lim did, right? Because they're famous dermatologists, they're out there and they must have done it right. No, folks, what I wish I knew was everybody selects their own pathway on this. And I kind of backdoored into this whole dermatology thing, right? I first was a family physician. My first residency was in family practice. I was a generalist. My second residency was in occupational medicine, preventive medicine, because I was interested in that interplay. I also happened to be with the US government at the time as an officer in the United States Public Health Service, who, guess what, needed a dermatologist at the CDC, right? This is circa 1990s, late 80s, early 90s. So it was sort of a matter of circumstance, a person with multiple interests. Public health is my major interest area, right? I looked at it from various perspectives, and where there was a gap was in the derm public health world at the time, right? No one was doing derm at the CDC, right? No one was doing derm in the occupational environmental sense. And then that's how my interest began. Interested initially very much in contact dermatology, in contact dermatitis, occupational dermatology, expanded that scope because of circumstances in the world to the world of bioterrorism as an officer in the public health service, ultimately serving as a commissioner, assistant commissioner at the Food and Drug Administration and counterterrorism policy, and then moving on from there to the office of the U.S. Surgeon General, where I was honored to serve as the acting Surgeon General and as the Deputy U.S. Surgeon General for about 5 years, including what Deb had mentioned, the release of a call to action, right? And that's my final sort of statement on this. A call to action from the Surgeon General's office is, frankly, a big move. Now what you had is you had a dermatologist as the acting Surgeon General. Oddly enough, there was another dermatologist who was the boss of the Surgeon General, a good man named Dr. Howard Koh, who was the Assistant Secretary of Health. You have two dermatologists in one spot. That's how we get calls to action on derm-related issues out, right? So a great question to start with, and I'm going to pass the buck now to Henry. Unmute, Henry, unmute.
You're muted, Dr. Lim.
Thank you very much, Boris. And as I said, it's always very difficult to follow Boris with a high degree of enthusiasm. I cannot match that. But I do agree with Boris that there is no one path to dermatology. And the question as to what I wish I knew, I probably cannot answer it very, very well. But let me address that by stating how I got into dermatology. I am the first member of my family who went to medical school. My father was in business, and I went to medical school as the first member. So because of that, I don't have any physician or healthcare individual as to serve as a role model and to serve as a sounding board, essentially. So when I went to medical school, totally what I consider to be undifferentiated, meaning that I enjoy medical school, I enjoy all the subjects in the first year and second year. And when I went to third year, I was totally having a very, very open mind. I did not know which specialty I would like to go into. So it is truly by accident. First of all, when I was a first year, I was paired up with a pediatrician to learn clinical medicine as a first year student. So I thought, well, this is fun. So I wanted to be, I was leaning towards pediatrics. So in the third year and fourth year, that's what I was leaning into without having very strong commitment to it. But nonetheless, I thought that this is something that I would enjoy. Then in the fourth year, when I was thinking more about it, I said, well, in order to be a good pediatrician, I need to know something about the skin. So I started to take an elective, which I only took one elective in dermatology, and I liked it very, very much. So based on that experience, I said, well, either at that time, this was quite a few years ago, so the match was totally asynchronized. Dermatology was not in the match yet, but pediatric was. So I said, I'll apply to pediatric, I'll go through the match. By then, the match came out when I took the elective. And then I applied to dermatology. I said, to this one particular institution that I was exposed to. This is the only institution that I applied for dermatology for. Within 2 weeks, I got interviewed and I got accepted, and that changed my career. So after a year of pediatric internship, I went into dermatology. Then after that, in dermatology again, I was still very much undifferentiated. What I knew is that I wanted to do academic dermatology because I do enjoy the intellectual stimulation, the interesting patients, the camaraderies in academic medicine. So I spoke to my then chair, Dr. Rudy Baer, I trained at NYU, and after for his advice, he said, well, that we have a faculty member whom I have just recruited from Boston doing some laboratory research on porphyria. So not knowing any interest in anything, but then I do know that I want to academic medicine, I decided to do that. So I spent about probably 6 months to 9 months in the first year doing laboratory research on porphyria. And then that branched off to clinical porphyria, starting seeing porphyria patients. But again, knowing that porphyria is a relatively rare disease, I thought, maybe I should branch out even more to look at and to get interested and to start studying other photosensitivity disorders. So I was quite involved in the photomedicine section of NYU, did that. And then from there, I expanded into phototherapy. And after a few years, expanded into photoprotection. So that's how I got started in the field of photomedicine, which is an area that I still do, and I enjoy it very, very much. The other aspect that Boris had mentioned about is that in terms of the administrative aspect, again, it is totally by accident. I went to at NYU. After that, I went to San Diego because my then laboratory chief decided to move to San Diego to be the chief of dermatology division there. Went there with her, And then after 3 years, for personal reason, primarily my wife, decided to come back to NYU, stayed there, and the then chair, Dr. Erwin Friedberg, said, well, there's an opening at the VA. Why don't you go to the VA to be a faculty there? Also, you can apply for VA research grant. So I did that, applied for research grant, got it. And then within the VA, after a few years, there is an opening of the chief of staff, which is the head of the VA medical side of the hospital. And never thought about it, but the director of the hospital said, why don't you apply? I applied, I got the position. That's how I started getting into administrative leadership aspect of dermatology, and eventually that moved on to getting involved quite a bit in the American Academy of Dermatology and eventually becoming the president. So it has been a fun journey, and truly enjoy every single aspect, even though clearly this is a various aspect of basic science, research, administrative activities, leadership activities. But throughout all that, I continue to see patients and continue to practice clinical dermatology, which is, I think, an important aspect that, that is our roots, and we need to be able to continue to do that. Let me turn this over to Ade.
So to let you all know, Drs. Lim and Lushniak are luminaries in the field. I'm just a young up-and-coming academic dermatologist trying to make my way. And so it's also instructive for me to listen to both of them in their journeys in, becoming, who they are. For me, I share a very similar story that I kind of, I don't want to say accidentally ended up in dermatology, but when I first started as a medical student, it wasn't what I thought I wanted to do. And I kind of allowed my scientific pursuits to lead me. And the thing that I found most fascinating in medical school was immunology. And you can think of the skin as this large immunologic organ with all these T cells, B cells, infections, all, autoinflammatory, autoimmune diseases, all these other things. So that was something that I found that really fascinating. So when I was thinking about a field, I was basically, do I do internal medicine or do I do dermatology? And I had some opportunity to do some research at NIH when I was in medical school, but I took a detour. What my wife would say, it's Barack Obama made you take this detour, which I disagree with. But it just happened to be in 2008 when there was all this discussion about health policy and all this kind of stuff, and I was in medical school at Harvard, and they had this program where they paid for you to get a master's in public policy. Not only they paid for the degree, but they actually gave you a stipend. So the only thing you were giving up was a year. And what I realized is that there wasn't a good foundation in medical school for people to really learn health policy. I happened to get this fellowship, and I did a year and some change at the Kennedy School of Government at Harvard as well. And then when it came time to marrying those things, so and Dr. Lushniak will probably appreciate this. This was actually around the time when he was the acting surgeon general, and I was like, you still can do dermatology and do a public policy, public health thing at the same time, which I still do right now. And so I was able to marry those kind of interests together, and I currently still do that. But right now, actually, what I do mostly is research on skin cancer and melanoma in particular. And that is somewhat related to immunology. But the reason why I bring this up is the question that we were asked, which was, what do you wish you knew, when you started your derm career? And what I want to impart on you is that it can be a lot of different things, right? It can be expertise in inflammatory disorders, expertise in cancer. You could be an expert in somebody that does surgical procedures and outcomes related to that. And it was that kind of breadth of things you could do that really drew me to dermatology. And I would say that it's a field that no matter what kind of work you want to do, you can kind of find your niche. And I'm happy that I decided to choose derm. And, as competitive as it is, it also chose me. So that's something that also is important.
Thank you. 3 very different answers. Love it. So our next question for our attendees tonight. Oops. Nope, I'm sorry. That is our 3rd question. Hang on. What do you recommend DIGA members do to reach out and get involved in community health as they begin their careers in medicine? Do we want to go around again? Dr. Lichniak, start with you.
Good. You know, what you've heard from the 3 of us is really, as I mentioned earlier, not one single pathway of getting into the world of dermatology. But we've had actually, we've emphasized things, you know, somewhat differently. But at one time, all 3 of us were exactly where you are now, right? All 3 of us were medical students. All 3 of us were trying to figure it out. So first and foremost, figure it out, right? You know, dermatology, let's be honest, is a tough specialty to get into. You know, it's one of those arenas where, once again, I will be the first to admit that if I were an applicant now, I don't know how I would do, right, in all this. And yet your job right now, your real mission as a medical student interested in dermatology is to what? Is to become a physician first and foremost, right? You're not becoming a dermatologist right now. Yeah, you got to do things to align yourself properly, right, to get into those derm residencies. But it's really become that physician right now. And I think it's critical in the midst of all this. And the importance in this question really is understand the community you're serving, right? Don't go into that community as a dermatologist. Go into that community as a medical student, as a soon-to-be physician, right? And the best way of doing that is use the opportunities in your various medical schools to have that connectivity with the community. Try to figure out who are the people that you are serving. Try to figure out their needs. Try to figure out what we call in public health, the social determinants of health, right? Beyond just the skin conditions that these people may have that we see as dermatologists, there are so many factors relating to that person that affects their skin condition. And now is the time to look at holistically that whole person. Do it through the community, do it through community activities where you're doing clinical work. But just as importantly, you know, there was a common thread in the 3 of us, right? And all of us were activists and continue to be activists. Fight for your communities, not just from the clinical side, but try to figure out what are their needs. Be involved.
Thank you. Dr. Lim?
Yeah, I agree. I think, you know, it is very important to get engaged, to be involved with the community. And all of you are in the medical schools, and I'm certain they are outreach activities, outreach organization within your school that you can get engaged in, you can participate in, free clinics, whatever. You know, there are many levels. Some schools are quite strong in community type of research, outcomes research, health disparity research, and so on and so forth. So just get involved with that, because there's how you get the most gratification, at least from my point of view, the most satisfaction on that. I can use probably a slightly different, at a different phase of my career as compared to where you are right now. You know, that's what I did when I came to Ford as a chair. This was in 1997. So at that time, coming from New York, you know, which is a very diverse community, as you know, but coming to Henry Ford, which is right in downtown Detroit, you know, it is a predominantly Black town, Black city. And at that time, I thought, well, you know, it is all the studies of diseases, treatments had been pretty much focused on lighter skin compared to darker skin type. And this is at the same time also where phototherapy had just been started to be used for the treatment of vitiligo, which clearly is very, very impactful, especially in darker skin individuals. So we were, when I came to Henry Ford, we were one of the very first centers that used narrowband UVB to treat vitiligo. That's how I got started with Multicultural Dermatology Center, with establishing skin of color centers, and that has continued to get expanded upon, to get involved with vitiligo, with hidradenitis suppurativa research, pigmentation research, the effect of visible light, and so on and so forth. But that all started because I knew there was a population that could definitely benefit from having more understanding, more research into to look at the type of diseases that this group of populations would be exposed to, would suffer from. And it is a very gratifying aspect to be able to help. And the community responds to that. You know, we established, for example, a vitiligo support group. All the members were all from the community. And it is very, very gratifying to be able to interact with them, to be able to give them whatever the latest information on the treatment of vitiligo. Is not perfect yet, but at least we're making progress. And they're very, very grateful. And as a physician, that is the ultimate gratification, isn't it? To be able to help your patient, to give your patients hope. So I think that you continue to get involved is very, very, and as a physician, not so much as a dermatologist only.
And I would echo what was just previously said. And then what I would add to what Dr. Lim was talking about is that in some medical schools, you may not necessarily have access to maybe a free dermatology clinic where they're offering, you know, care specialty related. But, you know, I'm probably a little bit closer to you in terms of when I went to residency and knowing how competitive it is and things like that. I think it's important that you also communicate to programs that you do care about social determinants of health, even if you're not necessarily volunteering in a dermatology clinic. If it is in a general clinic for the underserved, or you're working on policy related to getting access to care and things like that. And so if you are in a place where that's not a dermatology specific kind of underserved population isn't or organization is readily accessible to you, I think just being there for patients, no matter what, is something that is also important for you to develop as a clinician, to understand what people go through, and to make you better, as well as the community that is around you better.
Well said. Thank you. Just a reminder to everyone that if you have questions, you can throw them in the chat box. If you want, you can put them in the general chat, or you can send me a message so I'm the only one who sees them, if you are more comfortable with that. Our next question: when it comes to a career in dermatology, what do you think the biggest challenges and opportunities will be for people going into the field? And perhaps along with that, you could talk a little bit about how you see the field has evolved since you began your own practice.
Dr. Adamson, why don't you start this one and we'll work backwards.
So I think the biggest challenge for your stage about the field of dermatology is it's gotten like extremely competitive to get into. Even when I was applying, it also was like these abysmal stats and getting into. But my understanding is that in maybe the 80s and 90s, more further back than that, that level of competition wasn't necessarily there. But the Drs. Lim and Lushniak can correct me if I'm wrong. So, and I think that has been to some degree an impediment to how diverse the field is, or how some people that maybe arrive late to realizing that this is something that they want to do, and maybe don't necessarily have the option, to do it because maybe they didn't, groom the right relationships, et cetera, et cetera. And I honestly, just being fully transparent, think that that's something that is a challenge that I think as dermatologists, we are recognizing and we are working towards, especially in our organizations to really improve. I guess that's one area that I think that is a challenge. And the other for me personally, and this is kind of my area of research and things like that, is trying to really develop a evidence base for some of the things that we do as dermatologists. I think that evidence-based dermatology is something that it's been developing, but I think that it's something that is gaining momentum and strength. But there are a lot of open questions, about some very fundamental things that we do in dermatology that remain unanswered. And actually, I think that's why this is such a fascinating field. And I think, bright minds like the ones, here on the call can really help us move as a field, forward. And so to me, these are two problems in derm that I think that are, challenges in the future. They're not the only ones, but ones that are of interest to me.
Thank you. Dr. Lim?
Yeah, sure. I'll go next. I'm going to expand on what Ade had just mentioned in terms, I look at it as an opportunity, probably. I think diversity definitely is a very significant opportunity for our specialty to continue to improve upon. I think this started, I brought it to a head when I was the president of the AAD in 2017. At that time, the sensitivity or the recognition of the fact that, we do need to increase the diversity of our patient. The way I put it in my president's address is that we should try to make sure that the faces of dermatology as a specialty would reflect the faces of our patient. And so, I put as one of my 3 president's initiative to increase diversity in dermatology. As Ade had mentioned, it is very gratifying to be able to see that the whole specialty has embraced that, not only the AAD, which is the largest organization within dermatology, but also all the other sister society, the Women's Dermatological Society, the American Association of Professors, for example, and many other, practically all the subspecialty societies embrace that particular aspect. And nowadays, there are a lot of diversity-related activities for this time at the AAD meeting in Boston. For the first time, we will have a diversity, equity, and inclusion symposium. So those are activities that would increase the awareness of the specialty in general to try to make sure that our specialty is more diverse, but also at the same time to build allies, right? Because you clearly cannot have every single dermatologist to be of underrepresented minorities, nor is it appropriate. But you need to have allies of individuals who have the same commitment, the same sensitivity about making sure that our specialty is diverse, because our patient is diverse. So I think that is to me a challenge, and that it is something that we all have to continue to work upon. So that is one aspect. The other aspect, I think, you all are applying to dermatology now at a very exciting time in terms of the science of dermatology. Compared to many, many years ago, I think we have significantly much better understanding about the pathophysiology of the disease. And because of that, there are more treatment that has been developed. When I was in training, patient with vitiligo will tell them, well, there is nothing you can do. Try to tell them to try to live with it. Nowadays, there are many treatments of vitiligo, including JAK inhibitors, which is the latest set of treatments, and are not perfect yet again, but there are a lot of opportunities. Likewise, psoriasis. I think you all are familiar with the development of biologics, for example, which can clear patient 100%. In the old days, that was a very, very difficult endpoint to achieve. Atopic dermatitis is another area that currently there's so much research on there, so much potential medications that is coming in. Injectable clearly right now is available, but there are oral medications. They are also being developed and probably is going to be approved. In fact, one of them has been approved, or 2 of them has been approved in the past week. So these are truly very exciting opportunities to expand on what Ade has just mentioned, to develop the evidence base, the science of dermatology, so that we can better treat our patient. HS is another example of that. There are many treatments now for HS, not perfect yet, but again, much better than how it was before. So it's an exciting time. It really is. Boris.
And from my perspective, we talk about the challenges. I agree with Dr. Adamson, is the issue of the difficult process of getting where many of you students want to get, right, which is into dermatology residency. Once you're into that residency, then yes, it is hard work. Yes, there are many opportunities that open up, but right now, It is that whole idea of this being a really difficult field to get into. And it opens up the issues that Dr. Lim talked about in terms of the lack of diversity within the dermatology world in general. That's a major challenge, I think, for us. In terms of opportunities, let's focus even on what we've learned as dermatologists in these last 2 years of the pandemic. I actually look at the pandemic of not just being a pandemic of COVID. I use the term at our School of Public Health as the syndemics, which include what? Racism, intolerance, violence, political upheaval, climate change, right? You throw all that into the mix of the syndemics we've been hit with. This young medical students are your world, right? Your world that you're going to have to a large extent, battle a lot of these challenges, whether it's in the world of dermatology or in other fields. And all I can say is we, are here to, yes, continue our leadership roles, right? But you also are the up and coming leaders. As a dean of a school of public health, I say my main job is to do what? Is to train the next generation of public health leaders. In dermatology, our job is to train the next generation of dermatology leaders. And the challenges that we're, all facing at this point in time, not just in these last 2 years, but in societal upheaval in general, are many. It becomes a big job not to just only be, Dr. Pimple Popper, right? That's not what we accept, right? That's not what we do. There's so much more to being specialists in all sorts of realms in medicine. There's an honor, there's a mission, there's a lot to do. Take on those challenges. My last thing I like to say in terms of opportunities for each of you is, if the derm thing doesn't work out, what's plan B, plan C, plan D, right? It's not that you have to back into that right now, but there's so many opportunities in medicine, right? I'm a big fan of medicine, despite all the challenges that big medicine has. Why? Because of the opportunities it gives you, right? I'm also similar to Henry, had no medical people in my family. I'm the son of immigrants from Ukraine, post-World War II Ukraine, who spent 4 years in displaced persons camps, refugees in Germany, came to the United States. Did I ever figure that all this would lead to a career in medicine, to a career in dermatology, to sitting behind a big fat desk of the Office of the US Surgeon General? No, but that's the opportunity of what? Education in this country. Yes, throw in some hard work. And guess what, folks? Just as importantly, a little bit of luck.
Thank you. Boy, you guys are like making me think, I don't know, should I go to medical school now? And I'll
never too late.
Yeah, it might be a little too late for me, but we had our last question is really just advice for tonight's attendees as they pursue dermatology. But we had a question come in that's kind of similar, and I really love the way that it's been worded. What would you like to see in the next generation of dermatologists, and/or what is your vision for the future of the field?
Maybe I can start now so that we can have a fair turn. I think the future of the field, I'm an optimist. The future of the field is extremely bright. I think we really, as a small specialty, you all know dermatology is a very small specialty as compared to the rest of the house of medicine. We really are punching above our weight. We are very, very vocal. We are very active in terms of advocacy. And I think our government people in DC office of the AAD is very well connected to the government, to the Congress, and so on. So our advocacy arm is extremely active, advocating for dermatology, and as importantly, advocating for our patients. So I think our specialty is our future is very, very bright. Having said that, there are, I think, challenges that we have to be aware of. The scientific aspect, I think, is very, very important. I think it is very important for us to continue to treat our patient based on the latest scientific evidence. You continue to make sure that our patients and our public knows that we are a scientific-based specialty. In dermatology, it's very easy to say, well, I have treated 2 patients with this, this condition get better, hence this is the treatment for this condition. Sometimes we have to do that for very, very rare disease. But on the other hand, that is not ideal. Ideally, you would have a very good clinical studies, you have a very good understanding of the pathophysiology to develop the treatment and being able to say that this is the reason that this treatment works, and this is how this treatment had been developed. The other part, so I think the scientific aspect is very important. The second part, which in a way is a challenge and somewhat a danger of the specialty, is the commercialization of the specialty. As you know, right now, a lot of private equity firm is coming to dermatology. And I think that's something that we have to be aware of. The choice, obviously, is on each individual dermatologist. Is not for us to say you should not go into any practice that is backed by private equity. Everybody has to be comfortable making the decision. But I think you have to make the decision knowing that you would be able to continue to practice good dermatology. You'll be able to continue to practice good dermatology to take good care of your patients. So I think that is very, very important, rather than there to just generate revenue for the organization or generate revenue for yourself. Dermatology, none of us go hungry. So I think really money is not the only part. I think there's a greater calling for us to dermatology and to go into medicine in general. That I think we have to make sure that there is a balance of the financial needs, but also in terms of the ethical and moral need in being able to continue to treat our patients and our patients well. Let me turn this over to Boris. You're next.
Okay, in terms of looking at what I'd like to see in the next generation of dermatologists, and I'll specifically actually sort of talk about not only that question briefly, but also Hannah's question in the chat line, which is how do you kind of, what I'd like to see in the next generation of dermatologists, Hannah Schoaf listed there, is how do you sort of convince people that things are still important when we're dealing with all these mega issues, right? And this ties in with the National Council of Skin Cancer Prevention, and in essence, part of our message tonight. Everything is important, right? And everyone can't work on everything, right? So let's take a little pressure off ourselves, right? If I was sort of enveloped in right now and trying to figure out how am I going to solve the issue of the SARS-CoV-2 pandemic in this country, and that's my job, I would be so overwhelmed, right? There are others working on it. And this is a matter of passing the buck. Find what interests you. When it comes to skin cancer prevention, when it comes to sun safety, first of all, convince yourself that that is a worthy endeavor. That's what I'm looking for in the next generation of dermatologists. Find those worthy endeavors that you have a passion for, that have an impact, right? People die from melanomas, right? It's gotten better, but people die from them. We know that skin cancers are the most common cancer out there, right? Not all of them are lethal killers, right? But they have an impact, whether it's an impact on that person's appearance, whether it's an impact on their jobs, whether it's an impact on their financial status, whether it's an impact on the financial healthcare spending of our country. The reality is there is impact. So find something that you are interested in. And the field of prevention for me is a biggie, right? There are so many things out there, right? Sometimes it's the aspect of lifestyle choices, right? Healthy eating, active living, right? What do I do with my body? Do I abuse it with ultraviolet radiation or not, right? Find a way that you can actually rally around something that ultimately leads to the betterment of health, right? Of our society, population health, but ultimately better health of an individual. Ade, you're on.
I know we're running low on time, and what I would say, what has animated my career early on, at least, and my future, at least, is asking tough questions that are related to things that we take for granted in the treatment of patients or advice that we give to patients. And really following the line of evidence and trying to build that evidence base yourself. And I think in dermatology, a field that has, like 4,000 different diagnoses, some rare, some common, there are a lot of open questions that are ripe for really bright minds like you all, because it takes so much to get into dermatology. I mean, I think the future of dermatology is really bright. And it's just about channeling the brain power that you guys have in order to answering these questions and improving the care of patients with these skin diseases.
You know, let me just chime in one thing. I know we had another question out there from Jessica, and just briefly, Jessica, if you don't have a home program, right, that you can sort of latch onto for that, find that mentorship in your community. There's dermatologists throughout the whole United States, right? Reach out, be bold, right? Give that phone call saying, hey, I'm a student interested in this, right? There are so many opportunities. Show up as a student at one of our meetings, the American Academy of Dermatology, you know, or any of the subgroups. There's local meetings, right? There's local and state dermatological associations. As a medical student, they would be glad to have you there. Introduce yourself, be bold. That's one step to sort of finding that mentorship, even if it's not based in the home program. Back to you, Becky.
And in addition to that, let me just add two points that Boris had made a very excellent point. I think there are many organizations that has a mentorship program. Skin of Color Society, for example, has one. Women's Derm, for example, has one. So if you look around, there are many who has a mentorship program that you can apply to, and at least you'll get connected to an experienced dermatology mentor. The other one is that in the era of electronic communication nowadays, it is not too difficult to get remotely participate in research projects with mentors also. So those are the other two. Becky.
And the very practical word of advice is sometimes people might not answer emails. That does not mean that you know, you're doing something wrong. You might have to reach out to a few people before you get a response. And do not be discouraged. Keep trying.
Yep.
Great words to, I think, end our discussion on tonight. Thank you all very much for your time. Really appreciate it. With just a few minutes left, I'm going to turn it over to Alicia Rowell, the Vice President of AIM at Melanoma, as well as a SkinSmart Campus Co-Chair, who has a few points to make about how the Council can specifically support DIGA members. Oh, Alicia, you're muted. Of course.
Haven't we learned? Haven't I learned? Hi, everyone. I'm the Vice President of AIM at Melanoma and the co-chair of SkinSmart Campus, and AIM is a member of the National Council. And if you'll go to the next slide, I just want to quickly talk to you about how the National Council can help you. Some of these questions that you're asking, we can help you. So one, we can connect you with council member organizations. As an earlier slide said, our council comprises professional physician organizations, foundations, and federal agencies. You can begin to know our members early in your career, and they can help you. We can let you know about the council members' skin cancer prevention resources and events. All of our orgs have something to offer. We invite you to view their websites and contact any of us with questions or for resources. And I really want to take a minute to stress this opportunity the most. Even if, for example, you study one website per month of our members, it would be beneficial to you. And for those that interest you, join the mailing list as a suggestion. Keep apprised of what they're doing. There's a lot out there for those who are interested in dermatology in our National Council members' offerings. We can also provide you with ideas and recommendations for serving your communities. That was one of the questions one of you had in the chat and what we answered. There are so many opportunities at nearly all of our orgs. In addition, things that we're doing might prompt you to think about things you can do in your own community if you can't get to something that we're doing or offering, for example. We can promote DIGA's community outreach events through our National Council social media platforms. Just let us know how we can help. We can help you. We can assist you or someone you know with applying for the SkinSmart Campus Award for your school. This can be your medical school or your undergraduate alma mater. We had somebody in med school or public health from each of these schools be our champion. We'd really cover the nation. We also want you to be thinking after this whole presentation, how can we help you? These are our ideas, but I bet you have more, how we can support you, help you, give you information. We're more than willing to help where we can, and we're looking forward to a long-term relationship. please contact us for any interest in Don't Friday, SkinSmart Campus, or other ways we can help you. Thanks.
Thank you, Alicia. So with just a few minutes left, I'll just remind you that this recording will be available on our website, and the link will be sent around in that follow-up email. To our next slide, here is a list of our social media channels coming up, and our website, skincancerprevention.org. I would be remiss if I didn't also mention the Skin Cancer Foundation, skincancer.org, and you can find us on all social media at skincancer.org. Definitely check it out, as well as our other members. Lots of great information out there. To the next slide, here's the contact information for everyone who leads some of the initiatives at the National Council, including our executive director. And I will go ahead and throw my email address in the chat if anybody wants to contact me for any reason. And finally, before we go, a poll should be popping up on your screen any minute now. So please just take a moment or two to fill that out. We really appreciate you taking the time. And yeah, we hope to do this again soon. Thank you very much, everyone. Thank you again to our panelists and to our speakers. I just want to wish you all the best at this momentous time in your lives, and looking forward to working with you all. Have a great night, everyone.